back if you would like to look at this information later. But it's going to be posted on the Florida Association of Children's Hospitals website that will allow you then to be able to share this information with your teams as well. We know certainly there are other people that were not able to join us this morning that could benefit from this information. So we want to make it as readily available as possible. So I think that sort of wraps up some of our housekeeping items. If we can go to the next slide, please. Thank you. So the Florida Association of Children's Hospitals, for any of you that don't know, is a 13-member children's hospital association that actually works very cooperatively together and has for more than 20 years to be able to make sure that the children in Florida have the very best care possible. So we want to make sure that we provide advocacy as well as cooperative education and training out to our member hospitals. And we have done this and had a long history of providing information specific to the Florida Kid Care Program and training. So I actually probably do know some of you that are on the call, and we've done some kid care trainings before together. Today, though, we certainly wanted to address the fact that the public health emergency is about to end, which I know you are all aware of. And we wanted to invite our state partners to today's call to make sure that we could provide you with the most up-to-date and accurate information so that you have the resources you need to help families stay covered and to make sure if they're losing one type of coverage, they can move seamlessly into the coverage that is most appropriate for them. So we appreciate your time this morning, and we're very happy to have a couple of great speakers to provide this training for us that, again, we hope is going to be helpful for each of you throughout this year of the Medicaid redeterminations. So I'd like to start out by first introducing Julie Reed. Julie is the Deputy Director of the Office of Programs and Policy at the Florida Department of Children and Families. We're thrilled to have her here this morning. And as you can imagine, the department is fairly busy right now. So Ms. Reed will be with us until approximately 10:30. So what we will do is go ahead and invite Ms. Reed to present her presentation. And then if we have some time at the end, if you want to put any specific questions in the chat box, she could look at and try to answer. Then we will be able to allow her to jump off at 10:30, and Ashley and I will continue the presentation. So thank you, Ms. Reed, for joining us, and we'll turn the screen over to you.
Awesome. Thank you, Melanie. Thank you, Ashley. Thank you again for allowing us to come and speak to your group this morning. As Melanie said, I'm the Deputy Director of Programs and Policy within the Department of Children and Families Office of Economic Self-Sufficiency. The Office of Economic Self-Sufficiency obviously includes redeterminations for Medicaid, SNAP, as well as temporary cash assistance, or what's known as TCA. We're here to talk about Florida's Medicaid redetermination process and federally termed Medicaid unwinding. And so I know federally we've kind of used that term. For us, really, it's really getting back to normal. So we're excited to explain kind of our Medicaid unwinding, Medicaid redetermination process to you all today. But really, we want to focus on that it was how we conducted business and prior to the public health emergency. And so we want to go over kind of our plan that was submitted to CMS and kind of go from there. So if I could, and it looks like Melanie, you're going to operate the slides. Is that correct?
No, actually someone at Healthy Kids is going to be doing that for you.
Okay, so we can advance. I do want to announce I have a couple of my teammates also on the call. I have Kate and Bonzanita, and they're part of our Medicaid team. And so if we have any technical questions, I might be directing them to my teammate here. So just wanted to also introduce them on the call. If you notice their names here in attendance. Okay, so Medicaid overview. This is a pretty simplistic slide, but it is important to show since we have different participants in all of these different presentations we are doing. We want to make sure that we are talking about the different roles, federal agencies, state agencies, as it relates to Medicaid eligibility and Medicaid administration. So I think we're all familiar on this call, the overview of what Medicaid and medical coverage for low income and individuals and families, what that is. But there are a couple of key components, as you all are very well aware. We have our Agency for Healthcare Administration, who serves as the administrator of Medicaid services in Florida. And obviously, we're here on behalf of the Department of Children and Families, which is the Medicaid eligibility arm for Florida, as well as Social Security Administration, obviously, for SSI recipients. Okay, we can go on. Okay, as it pertains to Medicaid eligibility for DCF, without getting too technical, again, most of you in this room, or virtually, I should say, are very well aware of all of the technical, Medicaid eligibility. But again, individuals who are potentially eligible for Medicaid, pregnant women, parents and other caretaker relatives, children up to the age of 21, former foster care children up to the age of 26. And then we have our aging, blind and disabled population who are not currently receiving SSI. Obviously, you guys are also well aware of eligibility requirements and identification, residency, cooperation with child support, some of those type things. Okay, go on. So some of the income eligibility levels, and this obviously gets calculated every year, annually. And this should be the table that you all are pretty familiar with. It's posted on our website, and obviously it's a federally type issued federal poverty guidelines, FLP. I'm not going to go into it with this audience. If you don't mind, we'll save it for more time at the end here. We can move on. Okay, so what we have seen and what you all have experienced firsthand since March of 2020, obviously a huge Medicaid growth within the nation, specifically within Florida. You can see the rise year after year. Part of continuing coverage for Medicaid was the requirement of the Corona First Recovery Act that required continuous Medicaid coverage for enrollees in order for states to continue to receive FMAP and continue to serve individuals through the public health emergency. And so at last seen, we're really hovering kind of close to that 6 million mark here in the state of Florida. So as of April 1st, DCF again will return to normal business operations. But we did want to show kind of the Medicaid growth by numbers. Okay. So as we've heard, the Federal Consolidated Appropriations Act, known as the CAA, which was passed December 29th, really untied the continuous enrollment period for the public health emergency. Okay, so previously we were waiting kind of every quarter for federal news regarding the end of the public health emergency. And federally, they've always promised a 60-day notice. So every quarter we'd wait to see if there was an extension or not. As you're aware, for the last several years, that extension was put into place. And so really for the department, for DCF, we had to be prepared to start normal operations throughout the past 2 years. The CAA, in essence, untied the continuous enrollment and the public health emergency, meaning that we really now have an effective date of the end of continuous coverage, and that date is April 1st. federally to receive enhanced FMAP rates, and they really kind of titrate down actually all the way through the calendar year to the end of December. There are provisions that were put in place with the CAA in order to make sure that states receive the federal FMAP rates. And again, those are no stranger to us. We need to follow Medicaid eligibility requirements. There is an increased emphasis on making sure that we are in contact with beneficiaries, making good faith efforts on return mail. That has been a huge kind of effort federally, as well as some reporting requirements and different things of that nature. So a couple of things that were not related to the CAA, but were found, or not related to redetermination, but were found in the CAA. Federally, they've extended coverage for children under the age of 19 to 12 months. They used to be 6 months. So if you were determined eligible, you had 6 months previously, unless you were under the age of 5 and that you were granted a full year. At this time, you're granted a full year for every child under the age of 19. And really that coincides with the redetermination period that we already have. We conduct Medicaid redeterminations, as you're all aware, annually. So once we're determining your eligibility, you're good for those 12 months. Federally, they've also made permanent the state option for Medicaid postpartum coverage up to that 12-month period as well. The Florida legislature has already passed this over the last year. So in Florida, we're already doing this, as some of you might be already aware of. So that's the CAA in a nutshell. And again, the biggest thing is that continuous coverage and the untying to the public health emergency, and really truly giving us a starting date of effective April 1. Okay. So for us, as I've mentioned before, we're really returning to this normal processing. We always want to have some core tenets in what we're doing, and so we know our economy is strong. We have low unemployment rates, our wages are up, and we should anticipate that some individuals currently on Medicaid will follow suit with the rest of our public benefits. If you take a look at our SNAP, Supplemental Nutrition Assistance Program, or TCA, you'll know that it went up during the beginning of the public health emergency and our numbers went up, and then they slowly went back down to normal rates. So because of the requirements of Medicaid, we weren't able to disenroll anyone, as we've explained earlier, but we did stay in touch with our customers, and it's really important that we have all of the most up-to-date information to make sure that we're keeping in contact, so that when redetermination happens, we're able to get in touch with these individuals. Many of these individuals, as you all are aware, have really never gone through a Medicaid redetermination process or a renewal, but we've tried to stay in touch with them, and that's why you're starting to hear, things of address updates and making sure that they're keeping in correspondence if they're receiving any type of correspondence from the department or their health plans. There are some of our core tenets that we want to make sure that we're prioritizing exceptional customer service. We have a very strong communications plan, a community collaboration plan, and I'll go into these a little bit more, but we really wanted to first off leverage technology and try to create some operational efficiencies, not just for Medicaid redetermination for this period, but years kind of going forward. And we really wanted to invest in something that we could use. Like I said, it's part of our normal business process. So we wanted to make sure that we can use some of these things that we put in place, for years to come. So the coverage, if you're an eligible individual for Medicaid, we want to make sure that you maintain your eligibility, and we want you to know what that process is and what you need to do to ensure your continued coverage. We want to promote alternative health care options for those who are no longer eligible. Well, like I've mentioned before, enhanced customer service and engagement. So part of this, there are a couple things that we have going on to ensure that Floridians understand the process and have a better experience with Medicaid unwinding or Medicaid redeterminations. So first, we had to put in some system protections in place with our technology. As you can imagine, we pretty much hit the pause button for the last 3 years. So in March of 2020 and going forward, we had to make sure that when we hit start again, right, and we start our normal processes, that you aren't just disenrolling people and people follow that same process that is put in place. So there are federal requirements that we have to follow that you all are aware of. And so we did put in some systems protections in place. So we wanted to make sure that those things were set up. We also wanted to align individuals with different renewal dates. So there are a number of individuals who receive, as you're aware, SNAP, TANF, along with Medicaid, and they have to come in at different points of the year to do their eligibility determinations. That's inefficient for us because each caseworker, has to touch that case several different times and interact with that family several different redeterminations. We really want to use this opportunity to get some of those efficiencies. So it's also just a really good idea for families and individuals. They have to interact with the department possibly just a single time. So we want to make sure that we were leveraging that opportunity. Like I mentioned, a communications plan, being here with you all today, meeting with our industry partners, meeting across the state. That communications plan has been, helping us to make sure that we're connected. We have a lot of material. If you guys have been on our website or have seen our partner packets or any of those type of things that we have out there, we want to make sure that we're communicating this out to the public and it's available. The worst thing we can really do, as you've heard our leadership talk about, is to create panic. So we have a process. It's going back to that normal business operations that we spoke about. And we want to make sure that we're communicating clearly to individuals and that they understand kind of what they need to do. If they're still eligible for Medicaid, they can maintain that eligibility. We're just going to supply them with that necessary information to do that. We did a recipient address validation campaign. So one of the main concerns, as you all know, without communicating regularly and doing a redetermination in years, we wanted to know, have you moved? Have you changed your address? Are there household dynamics that have changed? We want to make sure that we contact you in this redetermination process. So we worked with our Medicaid health plans, ACA, and our MCOs, as well as our DCF EBT vendor for the most up-to-date address information. We were sending out postcards at the beginning, I believe, of February, and throughout the month of February. We just wanted to make sure that we were identifying individuals that they need to update their address if we had a conflicting address. We're doing some targeted call center operations. For our call center, this is one area that will not be, as we say, returning to normal. We know that we're going to get an influx of calls related to Medicaid redetermination, and we wanted to utilize vendor support and utilize dedicated call center staff. We have a number of self-service options as well for the public to possibly divert some of those individuals who might be calling the call center. They really can get their support that they need outside of the call center. Chat bots, things of that nature, going to their My Access account, things like that. Lastly, again, we've had stakeholder meetings across the state, such as this, associations, plans, different community partners. We really, really just want to get the message out, and that we want to make sure we are communicating that with the public. Okay. I think we'll do the interest of time. This is some of those things that we've covered. Just making sure that people are checking their mail. We've discussed the postcards. We have a yellow stripe campaign as well. I'm not sure if you've like me, but I mean, checking your mail, we try to figure out a way, is there some other way to get individuals to pay attention to the mail that they're receiving? So there'll be, a yellow stripe on their notices. To help with this, we're just trying to direct people that this is something that they may need to take action on. We'll have social media campaigns on it and, other, digital platforms. One thing we learned through our response to Hurricane Ian, is related to DSNAP or disaster snap. Text messaging was really the way to contact people. So we are implementing during this round really a text messaging effort and push to get a hold of individuals. We figured out that, usually someone responds pretty instantaneously to a text, where they wouldn't really for mail and things of that nature. IVR, that's our interactive voice response. It's kind of like our call center virtual assistants. You can update your address through that. And like I said, I mentioned our chat bot and things like that. Partners, just making sure, like I said, on our website, you can download our partner packet. You can sign up for those communications through our website as well. Okay. So we did do some technology enhancements. We wanted to focus on, like I said before, making sure that the changes we made in our technology were smart fiscal decisions and the state could be using those enhancements for years to come. Was going into one of those automated renewal processes we call, you might have heard us refer it to ex parte. So we're fine-tuning kind of different resources and sources that we hit for information to determine whether you're eligible or do we need to contact you for more information. Returned mail, there are a lot of federal requirements. If you've read through the CAA or any of the CMS guidance associated with returned mail. So we wanted to make sure we were utilizing automation to be able to have some efficiencies for us. We have online videos to make it easier for customers. If you go onto our website, you'll see a little bouncing green chat bot. And you can also have some information at your fingertips there. And like I said, some of those system protections. Okay. So we're going into the redetermination process, and the steps that it takes. But let's say that you're no longer eligible for Medicaid after going through the process. There are a couple things that are going to happen. If you're under the age of 18, we're going to provide you an automated referral to Florida Healthy Kids. So then that automated referral goes over to Florida Healthy Kids, and they're going to reach out to individuals. Florida Healthy Kids has also gone through some improvements and some efficiencies on their end to make sure that they're utilizing the eligibility information that was already provided by that family, by those individuals, in order to speed up that process. So to get families enrolled in alternative forms of healthcare, Florida Healthy Kids will be getting those automated referrals. If you're an adult, we're going to be referring you to other federally subsidized health programs, and they'll reach out to you with information. Or you'll be referred to, other medically needy program or things of that nature. Basically what it means, if you meet your share of costs through that month, then Medicaid could be potentially kicking in. There are certain eligibility requirements for that, and we won't go through some of those technical pieces, but we obviously want to make sure that people are aware of different options. Commercial coverage, as we're aware, it's safe to assume that some of the individuals currently on Medicaid, during the whole past few years, could potentially have jobs now and maybe other healthcare coverage, and they're getting healthcare coverage through other means. So there are other options for those individual federally qualified health centers, and things of that nature. So wanted to make sure this is a slide that we've shared quite often with the community. So just some different options for individuals. Okay. So our redetermination schedule, how we're prioritizing and conducting these redeterminations. As I mentioned before, we've stayed in contact with many of our customers throughout the public health emergency. We have around 900,000 individuals. The last time we spoke with them, that we determined that eligibility worker determined that they were no longer eligible for Medicaid. Those individuals are going to be prioritized first. There are the number is, I mean, obviously this is fiscally responsible to do, but also we want to make sure that these individuals have transitioned to other forms of healthcare. There's another group of individuals, we've attempted to make contact, and we weren't able to maintain contact with those individuals. So we wanted to make sure that if they're in this this unknown status, that we wanted to make sure that we're reaching out to them as well. And as I've mentioned, we want to use this opportunity to align our SNAP and TCA and Medicaid cases together where at all possible, so that we can have, limited reviews for that family member. That last priority group, down here, the last bullet is our most vulnerable. And we want to make sure that our children with complex medical cases are going last in this process. And so we've worked a lot with ACA and some of our plans to make sure that we can identify and put these individuals last in the redetermination schedule. Okay. If you've seen this slide before, you know that it's a very busy slide and there's a lot of things going on in this slide. But the biggest thing that, a couple things we want to make sure that we point out, there's a lot of things happening before April 1. And so, April 1 is, as identified before, the end of continuous enrollment. So we have to run our ex parte process beginning here in April, or I'm beginning here in March. If we are able to verify eligibility, we will continue coverage. If we do not automatically renew your case, a notice will go out 45 days prior to your case coverage ending. And so we spoke about this before, where a notice is going out in that yellow striped envelope. We're going to be sending text messages to these individuals. Again, like we have not previously done, but we know that is an effective means of getting in touch with individuals. We really hope that individuals take action, log on to your My Access account page. We want to make sure that we really are reaching individuals to be part of this redetermination process. If we do not hear from the individual around the 19th or 20th of the month that your coverage is set to expire, we will send you another notice saying that your coverage is going to be ending. So we really want to emphasize that we do need a partnership with individuals and their families. There are protections in place, so if they do not get back with us, there is a 90-day post that we can still determine their eligibility and reapply retroactive coverage. This process, as you can see, kind of just follows through for the remaining part of this year. This is just a client journey for certain situations, a couple of instances. The first one is kind of what we've explained, the ex parte process. The individual information comes back and you're approved. The individual does not have to do anything and they're automatically approved for 12 months. Instance 2 here, we have a family that we could not do that for. We could not automatically renew. So we asked for that individual to provide us information. so we can verify eligibility and maintain their benefits. Scenario 3, we attempted the ex parte, we couldn't determine eligibility, we notified you, similar to scenario 2. We processed, however, your eligibility and we determined that you were ineligible. And 2 things are going to happen, as we've explained earlier on. If you're an adult, you'll get referred over to a subsidized health program. If you're a child or a parent of a child, this referral will go over to Florida Healthy Kids and they will reach out to you. Okay. We've mentioned some of this before, but it's worth mentioning again. Definitely go on to our website. We have a number of partners out in the community. We've done countless amounts of these presentations, but we want to make sure that if you're interested and you stay in contact with us, please sign up for email alerts. Please check our website. There is a yellow banner that's going across our website that will link you straight to our Medicaid redetermination page. There's a lot of helpful information on there. We just really ask that people stay in contact with us. Right now, it's really important that we get the most up-to-date information on individuals. So anyone that's on Medicaid, please log on to your MyAccess account. If you're working with individuals, please have them log on to the MyAccess account. Make sure your address is correct. Your contact information is correct. And again, we're going to be contacting you through this process. So we want to make sure that when we do, we have everything in place and the most accurate information. And again, that's not just for April. As things go on through the year, individuals will have different redetermination months, right? So we want to make sure that we're kind of keeping abreast with people and making sure that throughout their next year, they're really keeping their information as updated as possible. Next slide, please. Quick kind of overview, do's and please don't. We understand the point of this slide is just making sure that we're pretty methodical in our communication with individuals. I think that there has been a lot of misinformation shared, and we just want to make sure that, again, we're not causing panic, that we're really assisting clients in order to maintain their coverage if they're eligible. We want to make sure that we're directing them at the right time in order to go onto their MyAccess account, look for their redetermination date that's posted on there. We don't want to just have individuals call the call center and we want people to go to the right venue in order to get their needs met. And so if that is a quick change of address, chatbot, if it's going on your MyAccess account, if it's logging on and helping people get their log on reset, things like that right now. What we don't want to really do is, just encourage people to just apply, because that's, we've heard that kind of out in the community. Well, everyone should reapply and they should reapply now. As we're aware, that's really not helpful for the system, and it's really not helpful for that individual. So just a quick reminder slide there. I believe we have one slide left. So federal guidance, every week, I think our team has been on federal calls and federal groups regarding the guidance. We did submit our Medicaid redetermination plan as required federally on February 15th. We have not heard formally from CMS. There's, as you can imagine, a whole process that happens with all of the states and CMS. So we're just in that process right now. But in the meantime, again, go onto our website, keep abreast of what is going on. Have your individuals that you're working with be on the lookout for this yellow stripe envelope. sign up for alerts and things of that nature. I think that was it. Formal slideshow.
Julie, thank you so much. You've already been incredibly generous with your time. And we do have a couple of other presentations. So in the interest of that time, would it be okay with you if we have people put specific questions in the chat box and we reach out with you to get those questions answered and distributed out to the group after the fact? Does that work for you?
Yeah, absolutely. Whatever works for you all, Melanie, and your group. Our team is here and we receive questions, as you can imagine, in every format. So after, if you want to compile them, and we can get the team together and respond, that's totally fine, Melanie.
That would be great. Thank you so much, Julie. And again, thank you for being so generous with your time today. I know this was very helpful.
Awesome. Well, good luck, everyone. And thank you again for all of your support as we kind of go through this journey together. So thank you again.
Thank you. Next, I'd like to introduce Ashley Carr. Ashley is the Chief Marketing Officer for the Florida Healthy Kids Corporation. Ashley is a friend to many of us as we've worked with Florida Kid Care to make sure that we are helping to enroll families, children, and to also make sure that we are disseminating information to our patients. So Ashley, thank you for your time this morning, and we're interested in hearing the streamlining and other aspects that Florida Healthy Kids has put in place to make this transition as smooth as possible for families.
Thank you, Melanie. I appreciate everyone's time and attention today. As you've heard, this process truly begins at DCF, and what I'm here to talk about today is what happens after children are referred to Florida Healthy Kids for potential placement into a different Florida Kid Care program. So Julie talked about what happens if families are ineligible for Medicaid, either because they did not respond to DCF's request or their income has gone up and they're simply no longer eligible for Medicaid. And then once they actually get that referral over to Kid Care, I'll tell you about what happens then. Perfect, so here's just kind of a simple introduction. As you can see, there's kind of a two-part process. We will receive information from DCF for two primary reasons. One being, of course, that household composition has changed or the income has increased so that it no longer meets Medicaid's threshold. We will also receive information on accounts where the recipients on Medicaid did not log into their MyAccess account and provide the updated information about income that was asked. And so without that information, DCF cannot complete a redetermination, and so those individuals will be removed from Medicaid. Of course, as Julie mentioned, there is a 90-day retroactive process where if an individual does, maybe they didn't get a notice or they weren't able to respond in time, if they figure out that they have lost their Medicaid, they can go back, submit information, and be reaffirmed on Medicaid with retroactive effect. The concern, I think, for this group today is that some of these families might not become aware that they have lost Medicaid until something happens and maybe they land themselves in the emergency department at one of your hospitals. So please do know that you can help the family collect their income information, submit it to DCF through that MyAccess account. It will be processed by DCF, and if that family is still eligible for Medicaid, they will stay there, and that will be retroactive to cover whatever issue they might be at your hospital for. However, we will also get information about those accounts to see if perhaps we can get them to respond to us. Now, of course, if they did not respond to DCF, they may not respond to Florida Kid Care. but we will do everything possible to make sure that those families are aware that there are other affordable health insurance options for their kids if they're not on Medicaid. Next slide. So here's a simple kind of steps process. So of course, first, DCF will send that redetermination notice, as Julie mentioned. Those will go out around the 15th of the month, leaving families about 45 days to respond. So for example, March 15th will be the first round of letters that go out. Those families have until April 30th to respond. If they don't respond by then, they will be removed. From there, once we receive the referrals, two things will happen. We will take the information from DCF as true and accurate. We will not go back and ask the family for the same information over and over. We're going to streamline that process and accept all of that verified information from DCF to make it super easy for the families. And we will only ask for information if it's absolutely required. So for example, if the parents make too much money, that means DCF was able to collect income information and verify it. So we will take that amount that DCF received, run it against our CHIP, or Children's Health Insurance Program eligibility, and place that child in the Best Fit CHIP program. Now, for those where parents did not respond, obviously we don't have updated income information, and so we do have to ask parents just for income information. They won't have to start all over. They do not have to apply. They don't have to resend birth certificates or driver's licenses or anything like that. They just need to give us those pay stubs or tax returns like DCF had asked so that we can figure out where it is that they belong. Some of those people might actually still be eligible for Medicaid. If that's the case, we'll review that income information and we will refer them back to Medicaid if that's where they belong. From there, parents will just have to take one simple action step. If they are a verified referral, then we have all of the information that we need. We are going to send them a letter basically saying, hi, you're approved for Florida Kid Care. We use the information from DCF to put you in a Best Fit program. Here's what your monthly cost will be. Here's what your benefits will be. If you're interested, just make your first monthly payment and you'll be enrolled. It's simple as that. The other group will be requested to provide that missing information, and if and when they provide it, we'll do the same thing. We'll take that information, develop the Best Fit program match, and then send them a letter saying, hi, here's your monthly payment amount. All you have to do is pay and your child will be enrolled. Next slide. Here's the same information, just presented slightly differently. It's sort of an if, then, and that process flow, so you can just kind of see if the referral information is verified or not verified, and there's a little note at the bottom that says the families where the parent did not respond, those are the ones who are considered non-verified. You might also hear the term termination or auto closure. Those are some other terms that DCF uses for those kind of non-compliant Medicaid recipients. Next slide. Perfect. So a lot of you are really familiar with how Florida Kid Care works. Of course, Medicaid for us is part of Florida Kid Care, so we really look at it as just shifting that child from one Florida Kid Care program to another. And so on the chart on your screen, you can see what the income thresholds are by percentage of the federal poverty level. So children between 133% up to 200% will fall into coverage through Medikids or Florida Healthy Kids for $15 or $20 per month, and that covers all eligible children in a family for just one monthly premium. We believe most referrals will fall within this category. Most folks coming from Medicaid, we anticipate will be eligible for $15 or $20 coverage. However, there may be families where the income has increased drastically, and they would be eligible for a buy-in product, or also known as full pay. And so if that family is above 200%, they also have the option to get the same really good CHIP benefits at a slightly higher cost that you can see on the screen. Next slide, please. So to put into perspective actual income amounts, because I know percentages of the federal poverty level is kind of abstract and it's not as easy to pinpoint what that means to a family, you can see here on the screen what those household amounts actually look like. So if you take a family of 4, they can make up to $60,000 and still qualify for $20 a month coverage. And then, of course, that income amount rises as the household size gets bigger. And so you can kind of get an idea here of where a family might fall from an at-a-glance perspective. Of course, these are gross annual income limits, and so that's something to keep in mind when you're sitting down with families, but it is a good resource to have as either a paper document on your desk to quick reference or something kind of saved to your desktop so that you can quickly flip through it if you have a family in front of you. As you may know, these amounts are updated every year by the federal government to include a small cost of living adjustment. These are the 2023 income amounts that will go into effect April 1st. Next slide, please. So as Julie with DCF mentioned, it is really important to get the information out there about this process. And so we wanted to make sure that at the very first letter parents got indicating that they were going to lose Medicaid coverage, that we put something in there that says, don't worry, there are other options, and you're automatically going to hear from Florida Kid Care. And so we developed this colorful insert that will go inside DCF letters to kind of provide a sense of ease right from the get-go. Next slide. Perfect. Similar to what Julie mentioned, we have a lot of different resources for families. We are going to reach out through text messages, emails, outbound calls. We're also going to run targeted digital ads so that our brand name remains top of mind as people are going through this process and having to make these decisions. We've also launched a landing page specific to Medicaid redeterminations. It's countonkidcare.org. We're looking at it to be a one-stop shop for information for families who are going through the transition from Medicaid to a different Florida Kid Care plan where they can get access to timing information as well as the answers to common questions. Next slide. We are also collaborating with community partners and stakeholders. We have developed a messaging toolkit for partners so that they can have plug-and-play, ready-made social media posts, these flow charts, letters to families, sample emails, a lot of different information so that, you know, it's a handy-dandy tool to also maybe print out or have on your desktop saved. We sent it out through a constant contact distribution list. Many of you may have received it if you're on our listserv. If not, what we can do is maybe take all of the email addresses in the chat and send it out to that specific list. And you may get it twice, but if not, you might receive it for the first time. But we do want to make sure that you all do have it. There is a second email we sent out on Friday that has the release of information forms that you'll need if you want to communicate with us on the behalf of a client. We've made them fillable forms to make it a little bit easier. We've also communicated with our legal counsel, and electronic signatures will be accepted. So we want to make sure you all have those as well. We're also creating a tracking log for concerns. So for example, if you have a family that came in and said, well, I didn't get anything from Florida Kid Care, but I lost my Medicaid, that's something we would want to know. And so we're providing a sample tracking log so you can create that actionable information to send up to us so we can log into our systems and figure out what went wrong. So we will also share that email with all of the emails in the chat as well. So if you haven't put it in there, please make sure. Next slide, please. And one of the biggest pieces of information folks might have is projected enrollment. So as you can see, a lot of Florida Healthy Kids, CMS, and Medikids enrollment shifted to Medicaid during the public health emergency. And that was because a lot of families faced financial constraints at some point during the COVID crisis that either maybe went from 2 households down to a 1-income household, or maybe both parents stopped working. And so once they shifted down into Medicaid, they've been stuck there even if they have gone back to work and would no longer qualify. And so what we're expecting to see through this redetermination process is kind of a reversal, that we want to get all of that enrollment back plus some additional. So as you can see, The projected enrollment numbers in blue are what we're looking to see after a year of this process. And I know I went through a lot of that information really fast, but we still have one more presentation, and so I will hand it back to Melanie.
Thank you so much, Ashley. We really appreciate that. There are a couple of things before I start to talk about the marketplace that I'd like to point out just quickly in terms of some of the things that you touched on, Ashley, but maybe a couple of other things that might be helpful to this audience. One is that I would like to point out, as folks are enrolling their children in the Healthy Kids programs, one of the things that you may or may not have experienced before is that as you're helping families, especially now that these streamlines have been put in place, as you're assisting families and they are able to be enrolled and pay their first $15 or $20 or even full pay premium, that family is able to ask for that premium to be applied to the current month. They don't actually have to wait until the first of the next month. Again, there's a little bit of a timing issue there, but it is certainly worth a phone call, especially if you are seeing a family within the emergency department or an admission, and they're not only concerned about the cost of that visit, but also how they are going to make appointments for follow-ups with specialists or be able to get needed medications. So I do think that's a piece of information that for this audience is really helpful. I also really do want to commend both the DCF and Florida Healthy Kids for looking at some of the streamlines that really is going to make this process easier for families. For example, the ability to accept a predetermined income amount and not have to make families submit the same information for a second time for determination, as well as the ability to use things like fillable forms and electronic signatures. So all of that, I think, really does lend itself to streamlining this process for families. With that in mind, I would like to talk a little bit about the health insurance marketplace and some of those options for families. Again, that could be a presentation, an hour presentation in and of itself. So I'm just going to hit the highlights specific to what's happening with the Medicaid redetermination process, or again, the unwinding process, and would love to provide some answers to any questions you might have at the end if we have time. But the federal marketplace has actually released guidance that says that there will be a special enrollment period for anyone losing their Medicaid or CHIP coverage that can begin anytime 60 days before the last day of coverage, or anytime between March 31st of 2023 and July 31st of 2024. Now, typically, when someone loses coverage, they get a special enrollment period that lasts for 60 days after the loss of that coverage. This extends that 60 days much longer than that. So if someone does lose their coverage, let's say they lose it on June the 1st of this year, as a result of not following through on determination, or they've been determined that they are over income, they can actually enroll anytime between June 1st, or 60 days prior to that actually, and July 31st of 2024. So that gives great opportunity for anyone losing that coverage to be able to look at what their options are through the marketplace. The marketplace also could be particularly helpful for certain populations. So if you'll remember back to that flag chart that Ashley showed that had the different colors of a child's age and what their family income was, what program that child would probably be enrolled in, there was a piece at the top left-hand corner that was missing, and that is infants 0 to 1 that are above 200% of the federal poverty level. And that is because there is no full pay option through Florida Kid Care for that population. There are plenty of options on the marketplace for infants. So if you have a family who doesn't have access to employee-sponsored insurance, or their family coverage through employee-sponsored insurance is very expensive, it is very much in their interest to look at the marketplace, because the amounts for premiums on the marketplace are determined. One of the ways that it's affected is by the age of the person being covered. And so for infants, you can find good coverage for a very reasonable amount, and certainly sometimes much lower than what you can find with family coverage. So it's worth taking a look and sort of comparing those costs. Another population are children with special health care needs, particularly those kiddos that are medically complex, that are probably going maybe above the threshold for children's medical services. And they can absolutely look at the full pay programs through Florida Kid Care, but it may be that there are providers or therapies or medications that are not covered by that specific network. There are hundreds of plans out there on the marketplace, and there's a great tool on healthcare.gov that families can put in the name of their preferred hospital, their medical providers, their medications, and the tool actually teases the plans that will cover the vast majority of those. So again, I know many of you have worked with families that have medically complex children, and they are very attached to those providers, some of whom have been caring for their child since birth. And so we do want to make sure that there are other options that look at the broad network of specialists, pediatric specialists, and medications that these children might need to tap into. Also, again, I'm a big fan of the full pay program through Kid Care, but one of the things that does happen, and certainly families that I have worked with, is that it is a great deal for a family who has one child. And for $259.50 a month, they can get a great pediatric-friendly plan that has 0 deductibles and has very, very low copays. So that's family friendly. As you add a second child for that amount, it can get a little bit pricier for families. And as you have 3 or more children, sometimes those full pay programs can become out of reach. So I do want to encourage you to look at, or I'll talk in a minute about who you can work with that will help a family look at what some of those options may be on the marketplace that might come with deductibles, but at the same time, the premiums may be much more affordable for families. And then last but not least are parents that are in the medically needy program. So we are so fortunate in Florida to have the medically needy program. It's a beautiful thing to provide coverage for folks that are in those categories that they would qualify typically for Medicaid, but are above income for that. However, it's important to remember that the medically needy program is not actual coverage. Medically needy is a safety net program that works beautifully, by the way, with other coverage options, because being enrolled in medically needy does not mean that you can't be enrolled in the marketplace as well. You absolutely can. And in fact, the other piece of that is very helpful to keep in mind is that if the medically needy program can actually help somebody who has a high share of cost deductible it has a high deductible on a marketplace plan, the medically needy program can help that individual pay down that deductible. So I'll give you a quick example. If you have a parent and their share of cost for the medically needy program, that deductible is $3,000. but they have a marketplace plan that has a high deductible, for example, a $6,000 so deductible. They get a hospitalization. They certainly are over that $3,000 share of cost. Once the medically needy program kicks in and pays that bill, it actually goes toward their deductible in the marketplace, and they are able to then continue to utilize their marketplace coverage without having to meet that deductible. So it's kind of a win-win. What the research has shown us is that if parents are enrolled in coverage, it is much, much more likely that children will also remain covered in that family. So just having a culture of coverage for a family is something that we can help facilitate as we're working with families in our children's hospitals. Next slide. And then, as I've talked about with looking at Marketplace, there are some great organizations out there. And when we talk in a minute about resources that you're going to be offered, there are navigator organizations that have been trained to provide very objective assistance in helping people look at the best fit of coverage options based on a family's income and medical need. So if you haven't already, I'd like to really encourage you to make sure you go into the chat feature, put your name, your hospital, and your email address, because one of the things, excuse me, that will be offered is a list of navigators in each of the areas statewide, the organizations you can contact, and they will actually connect you directly with a navigator that can assist that family and make sure that they have good objective guidance through that entire process. Along with the list of local navigator organizations, the other thing that we're going to provide as resources as a follow-up to this would be a reporting and tracking tool that Florida Healthy Kids is going to be utilizing to make sure that they're collecting good, concrete, case-specific information about how this process is going, or some of the glitches that you may be experiencing that they may be able to help resolve for you, as well as be able to keep their fingers on the pulse of the trends as this unwind begins to happen. We're also going to be able to send to you the entire Kid Care toolkit that Ashley sort of referenced and showed you pieces of today. I think it's an excellent toolkit, and it's something that we'll be sending out also to administrators to make sure that they are getting to your marketing and public relations teams so they can help spread the word to your patients' families about how they can be on the lookout for the yellow striped envelopes. They can keep their information up to date. They can utilize some of the tools on the different websites that were referenced today. So be on the lookout for that. And then last but not least, we'll be sending you very specific instructions of how to access the recording for this particular presentation. So if some of you are interested in sharing this with your teams, that will be available to you through the Florida Association of Children's Hospitals website. That was a great deal of information in a short amount of time. Ashley, do you have another couple of minutes? You could stay on for questions. And if for any of you have questions that don't get answered by us personally now, if you would like to, again, put further questions in the chat box, or if you had questions that you would like us to get over to Department of Children and Families, we will make sure those answers get distributed to the group as well. So Ashley, are you able to stay on for a couple more minutes?
Sure.
Great. So we would like to open it up for questions now for Ashley or myself. The reason I put my email address here, by the way, is so that you're always welcome to reach out to me if you have specific questions that the association can help support. But also, if you would like to be able to go onto that JOT form, that is very specific to this whole redetermination process, we have provided that link for you as well. So if there are folks that would like to ask questions, we'll open it up for the next 5 minutes or so. Any additional questions, please feel free to put in the chat box. I can hear your microphone on, but not the question. Did we have somebody that would like to ask a question?
I see a question in the chat that says, are only individuals due for a renewal receiving notifications? What if they completed a renewal late last year? So that is a question kind of for DCF, but Julie touched on it a little bit. They did throughout the PHE process, although they were not removing people from the program, they were asking folks to come in and update their information. Some did, some did not. So even if they did log on in the last 3 years to provide updated information, they will still have to do it again sometime between now and the next 12 months throughout this Medicaid redetermination process. As Julie mentioned, if folks did log on in the last 3 years and update their information, if it looked like that information was too high for Medicaid, those people are likely going to be part of that 900,000 group that are likely ineligible, and those will be redetermined first.
Thank you, Ashley. Anyone else? Well, thank you so much for your time today. If you do have specific questions and want to reach out to me, I will make sure that it gets to the appropriate person for answers and also distribution out to the group. This was a great group on today, and we hope that this information was helpful. We tried to tailor it as much as possible to the audience that really is working very directly with families. I will say that I think children's hospitals are going to be gigantically important in this process. Many families for the very first time may be learning that they no longer have Medicaid coverage as a result of an emergency room visit or as a result of a hospitalization or an ongoing treatment. And obviously, we want to make sure that our patients and their families go through this process as seamlessly as possible. So if we can be supportive of you in that process at all, or you would like to provide information back to us about how the process is going for you, we really would like to make sure that you have those resources available to you. So again, jot down my email address. We will, for everyone that provided their information today, we will have all of these resources out to you. And we look forward to continuing to work with each of you and supporting you as you support families and making sure that we make this as smooth as possible and that our patients and families get the care that they need. Thanks so much, and thanks for joining.
Thank you. Bye-bye.
Thank you. Bye-bye.